Good afternoon and welcome to another episode of Let's Talk with Dr. Celeste, MD. We are coming to you live today from Atlanta, Georgia. We are in transit visiting family, but wanted to take a few minutes today to discuss a topic with you about self-care. Today's topic is about annual exams. Hi, Ms. Golson. Thank you so much for joining us. Today's topic is about annual exams, and I thought we would start with women first. As some of you may know, for this month, we've been discussing self-care topics that are really important for us to take better care of ourselves. I've been just focusing on some ways this month in which all of us can try to do better to take better care of ourselves, because when we do that, we have better health. Hi, Ms. Golson. So we'll wait just a few minutes to get started. We're coming to you live today from Atlanta, Georgia. It's a sunny day outside, and I have a guest with us who wants to say hello. Say hi.
Hi.
That's Miss London. So she's joining us today for our Facebook Live. And so again, today's topic is annual exams, and we're starting with women. Now, one of the reasons why I thought that it might be a great topic to try to encourage us to make sure that we take care of annual exams is because that is a vital part of self-care. And forgive me if my camera is moving a little bit because we're in transit today. I apologize. We were kind of in transit and don't have our usual setup that we have, but wanted to make sure that we took time to share this with you. Hi, Miss Mylan. How are you? Thank you for joining. So today's topic is annual exams for women. And so let's talk about the annual exams that we recommend that women have each year. One important part of annual exams is very important for us to go over a good history with our physician. Part of the reason why the history is so important is because with your history, not only do we get a chance to learn about what's going on with you now, but it also gives us a chance to be concerned about what things that we would have to be concerned about in the future. And so as a part of that, part of going through your medical history, your physician may ask you what challenges health-wise that you've had. They may ask you about the things that your family members have had. The reason that they want to know about what your family members may have going on is because a lot of times we use that as a foundation to find out what things that we should watch out for. Hi, that's my sister Rabia watching. Hi, Bibi. Say hi to Auntie Bibi, London. Say hi.
Bibi.
And that's Miss Black watching. Hi, Miss Black. Thanks so much for watching.
Miss Black.
So the past medical history is very important. As part of your exam, we also will we look at your vital signs. The vital signs are important because we look at your blood pressure to see where it's running. We'll ask you questions if your blood pressure is not within a normal range to try and ascertain, hey, why is the blood pressure abnormally high or low today? Looking at your heart rate as well as your respiratory rate are things that will give us a clue as to if there are other things that we need to be concerned about and screening for. So, as part of your physical exam, your history is very important. Another important part of your annual exam is your social history. And with that, we'll ask you, hey, do you exercise? Do you drink alcohol? Do you smoke? Do you work? And if you do work, how often do you work? All of these things play a part. We'll also ask you about your vaccination record. And that's something that's very important, especially depending on what ages you are. So these are all the things that we'll go over in addition to your actual physical exam. As part of your physical exam, in addition, hey Celeste, how are you? There's Miss Celeste. Say hey to Miss Celeste London.
Hi, Mrs.
Celeste. As part of your physical exam, not only listening to your heart, we listen to your lungs, we'll look at your legs to make sure they're not swelling, but specifically for women, we do a breast exam. Now, let's talk about the breast exam, and I'll get into, I know that everyone's aware that Breast Cancer Awareness Month is next month, and we'll get into more detail about that, but it is important to have that annual breast exam. In addition to that, making sure that you have a mammogram. We'll touch on that in just a moment. As a part of the physical exam also, you'll have a pelvic exam. And one of the things we do with that pelvic exam is a Pap smear, which starts at the age of 21 years old. And so from 21 to 65, they're now currently recommending that you have a Pap smear once every 3 years between 21 years old and 65 years old. The Pap smear is a screening for cervical cancer. That's something that's very, very important. And so I encourage all you ladies out there, 21 to 65, to make sure that your Pap smear is up to date. If it is not, hey, let's get that up to date. So let's talk about some other things that we do. Let's talk about the lab work. We may look at your CBC or your complete blood count. We may look at your metabolic panel. And we also look at your urinalysis. These are things that help to tell us, is this person anemic? Is the liver function okay? Is the kidney function okay? The urinalysis tells us if you're spilling protein into your urine, which sometimes is a sign of people that may have elevated blood pressure. Additional labs are a lipid profile. That's a cholesterol profile. They recommend at least one lipid profile every 4 years. If there are any risk factors for heart disease, we may screen more often than that. That's something that I'm very passionate about. And so I always make it a point to try to make sure that people know what their family history is and we know the things that we should be screening for. And that once we find these things, that we actually address these things so that we can be healthier. So we will do the blood work. In addition to that, when you reach the age of 40 years old, ladies, that's a very important age. At 40 years old, you'll have your first mammogram. In between the ages of 40 to 44, the American Cancer Society allows those women to decide, do you want to have a mammogram every year? I encourage every woman, once you turn 40, to have a mammogram every year. Once you turn 45, they mandate that you have a mammogram every year. And so let's make sure that we stay up to date on those, okay? Next magic age is the age of 50. At 50 years old, we start our colorectal cancer screenings. And so we have another visitor that's kind of coming in the camera saying hi. Say hi, Lila. So we have some guests today, guys. I told you I was visiting family that are joining in on our annual exams, and they love our Facebook Live. So they're wanting to say hello to you guys because they're like, what is T. Leslie doing? Why is she talking to these people about medical things right now on a Sunday? So, and again, sorry about that. So colorectal cancer screenings, those start at 50 years old. Everyone should have those. If you have family history of colorectal cancer, we recommend that you have that screening, that colonoscopy earlier than that. Those, I cannot impress upon you the importance of these screening tests in the prevention of you having a disease that proliferates more and that we can do something about it sooner. So that's all we have to share with you today about annual exams. Just make sure you're having your annual exam, because I know it may seem like all they do is just check my temperature and my blood pressure and it doesn't mean much. But all of the things that we collect during those annual exams help us to take better care of you. So I encourage everyone to have their annual exam. Ladies, make sure you're getting your mammograms, your Pap smears, and your colorectal cancer screenings. We will share on next week about annual exams with men, and we'll try to share some things with you during the week that can help us to take better care of ourselves. Again, it is Self-Care September, and we're going to sign off. I hope everyone has a happy Sunday. I think the girls are going to say, let's have a happy Sunday here. Say happy Sunday, everybody. Happy Sunday. Okay. So with that, ladies and gentlemen, I'm going to go ahead and sign off. And sorry about the little transitional part here and not having our normal things, but we're in transition and visiting family, but still trying to stay in tune with you and stay in touch and help us take better care of ourselves. So have a happy Sunday. Hey, Dr. Lakeisha, thanks so much for joining. Okay, have a happy Sunday, everybody. Bye-bye.